Feeling nausea, vomiting, or tiredness? What about the periods? You've also missed your periods? So you think you might be pregnant? Not a big deal. You can take a pregnancy test to find out for sure. You do this by seeing your doctor or buying a home pregnancy test kit from a pharmacy or supermarket. If a woman misses a period or other signs suggesting that she may be pregnant, it is a good idea to take a test. A woman should know as early as she can if she's pregnant, as she will probably need to monitor her health more carefully, and she may need to make some lifestyle changes. That is why a pregnancy test is a must as early as you feel the symptoms. Welcome to my YouTube channel, Mama's World. In today's video, I'll be telling you about pregnancy tests and how it works. So stay tuned until the end of the video. You're really going to learn a lot about it. Also, please subscribe to my channel if you have not already done so, and hit the bell icon to remain updated. Let's move on with the video by explaining what a pregnancy test is. What is a pregnancy test? A pregnancy test is to determine whether a female is pregnant. The two primary methods are testing for the female pregnancy hormone in blood or urine using a pregnancy test kit and scanning with ultrasonography. Pregnancy tests measure the level of the pregnancy hormone HCG in your urine or blood. HCG is produced during pregnancy and can be detected in your blood as early as 6 to 8 days after conception happens, when a fertilized egg attaches to your womb, but not in your urine until a day or two before you expect your period. The easiest thing to do is to wait until you have missed a period and then test. If you test your urine too soon, you may get a negative result when you're actually pregnant. Some test kits recommend testing a week or two after you have a negative result if you have not had a menstrual period by then. Be sure your test hasn't expired and read the instructions before you use the test. How pregnancy tests work. Pregnancy tests check your urine or blood for a hormone called human chorionic gonadotropin, HCG. This hormone is produced during pregnancy and can be detected as early as 10 days after conception, when a fertilized egg attaches to your womb. HCG level increases during pregnancy. It is produced by the cells that form the placenta and provide nourishment to the growing embryo. A urine test can be self-administered at home, but a medical professional must perform a blood test. Most pregnancy tests come in a box that contains 1 or 2 long sticks. You pee on the stick and see the result appears on the stick after a few minutes. A pregnancy test is 99% reliable. If HCG is found in your blood or urine, it is highly likely that you are pregnant. Home pregnancy tests. Home pregnancy tests detect HCG in your urine. There are different types of home pregnancy tests, which you can buy over the counter from a pharmacy or supermarket. Some digital kits are more accurate than traditional test kits. With most tests, you either hold the end of a chemical dipstick in your urine stream or collect the urine in a container and test it. The dipstick tests for HCG and uses colors or symbols to show whether or not you are pregnant. For example, they may show a pink or blue line or a plus or a minus sign to show a pregnancy. Digital dipsticks may state the words pregnant or not pregnant and can be easier to read. Most pregnancy tests can detect HCG in your urine on the first day your period is due. But to get the most reliable results, wait until at least a week after your expected period before testing. Then, the amount of HCG should have built up in your body if you are pregnant. Read the instructions carefully before doing a home pregnancy test. It is best to collect the urine sample first thing in the morning before you have drunk a lot of fluid, or there might not be enough HCG to give a positive result. If the test is negative, but your period still doesn't come, you could try retesting in a few days. If the test is positive, it is most likely that you are pregnant. It will only be in very rare circumstances that you will get a positive result that is incorrect or false. Some home pregnancy tests are more sensitive than others. In other words, the amount of HCG needed to be detected in the urine to produce a positive test result is lower in some tests. Many pregnancy tests claim to be 99% accurate. However, home pregnancy tests differ in the ability to diagnose pregnancy in women who have recently missed a period. If you have a negative test but think you might be pregnant, repeat the test 1 week after your missed period or talk to your healthcare provider. Always check the test's expiration date and read the instructions carefully before you take the test. Are home pregnancy tests ever wrong? Taking a home pregnancy test can be nerve-wracking, especially if you're not sure you can trust the results. If the test was positive, you're very likely pregnant. Home pregnancy tests are quite accurate and will not register the presence of HCG unless it is actually there. False positives, testing positive when you're actually not pregnant, are extremely rare. The test only tells you that you are pregnant and doesn't give any information on the health of the pregnancy or the likelihood of having problems with your pregnancy, for example, bleeding or miscarriage. Once you see a positive test, it's time to book an appointment with your healthcare provider. In the meantime, eat well and avoid alcohol, drugs, and tobacco. Continue to take a folic acid-containing prenatal vitamin every day if you have not been taking one already. Pregnancy tests performed by a doctor. More often, you may take a home pregnancy test to quickly determine your pregnancy. If a home pregnancy test is positive and you have decided to continue with your pregnancy, you should call an obstetrician as soon as possible. The doctor can use a more sensitive test, such as blood testing, along with a pelvic exam to make sure you're pregnant. Seeing the doctor early in your pregnancy will help you and your baby stay healthy. Nurses, doctors, or specialists confirm pregnancy with either urine or blood tests or through ultrasound. The urine tests are similar to the home ones. These tests show the results much faster than a pregnancy blood test, usually within a few minutes. Blood tests for pregnancy are more sensitive and accurate than urine tests. They can detect whether the hormone is present in your blood and how much HCG there is. A sonogram, or ultrasound, is a test done during pregnancy that uses reflective sound waves to produce a picture of a fetus. The picture is displayed on a TV screen and may be in black and white or in color. The picture is also called sonogram, echogram, or scan, and they may be saved as part of your medical record. Testing the level of HCG and the rate at which it increases is one way your doctor can tell if your pregnancy is normal. For example, an extremely high HCG level may be a sign you're expecting twins or have some disorder. The following question often arises: what is the difference between a home pregnancy test done at home and a urine test performed at a doctor's office? The difference is not in the test itself, but in the ability of the person who reads the test confidently. What if I'm pregnant? If your home pregnancy test shows you're pregnant, congratulations, kudos. Always consult your doctor. Your doctor will confirm the pregnancy, work out your estimated due date, and check your overall health. They'll talk to you about any previous pregnancies, your medical history, and any changes you should make to your lifestyle to ensure a healthy pregnancy for yourself and the baby. They will also talk to you about how you would like to be cared for during the pregnancy and where you would like to have the baby. So now you understood the pregnancy test in detail. It's time to say goodbye to you. We'll meet you in the next video with another exciting content only on Mama's World. Till then, take good care of yourself. Don't forget to like and share this video. Thank you.